My name is Dr. Sean Graham, and today I am presenting my meta-analysis on the psychological effects of evacuations during disasters. While evacuations are essential for saving lives, they often carry an invisible cost, the profound and lasting impact on mental health. Disasters such as hurricanes, floods, and wildfires force people to leave their homes abruptly, separating families and disrupting social networks. My analysis synthesized findings from 10 peer-reviewed studies published between 2017 and 2024. Across these studies, displaced populations consistently showed higher rates of post-traumatic stress disorder, depression, anxiety, and adjustment disorders compared to those who were not displaced. Vulnerable populations. The data reveal that several groups are particularly vulnerable. Children. Many experience academic regression, anxiety, irritability, or even bedwetting after evacuation. In the chaos of displacement, separation from caregivers magnifies these outcomes, leaving lasting scars on development. Older adults, especially those with dementia, limited mobility, or chronic health conditions, often experience confusion, helplessness, and heightened medical risks when care routines and medications are disrupted. Low-income and underserved populations. These groups frequently endure longer displacement periods, face housing instability, and have limited access to mental health services. For them, the stress of evacuation compounds with economic hardship and social inequities. Environmental stressors. It's not just who is displaced, but also how they are displaced. Shelters, while life-saving, often intensify trauma because of crowding, lack of privacy, noise, and inadequate sanitation. Prolonged displacement further deepens these wounds. For example, families displaced by hurricanes. Harvey and Maria remained separated for months, with many still struggling years later to regain stability. Implications. These findings make one thing very clear. Evacuation is not merely a logistical task. It is a public health concern. When we fail to address the psychological toll of displacement, we leave communities vulnerable long after the storm has passed or the fire is out. Mental health must therefore be a core component of disaster preparedness, response, and recovery, not an afterthought. Recommendations based on this evidence, I propose several strategies to improve outcomes. Pre-position mental health professionals in shelters to provide immediate care and counseling. Train shelter staff in trauma-informed communication, psychological first aid, and de-escalation techniques. Expand telemental health services to reach displaced populations, particularly in rural and underserved communities. Build community-based resilience programs, including peer support groups, school counseling initiatives, and partnerships with faith-based and civic organizations. By institutionalizing these practices, emergency managers can reduce inequities, support vulnerable populations, and strengthen community resilience in the face of future disasters. Conclusion. In closing, evacuations save lives, but they also disrupt lives in profound ways. The invisible wounds of displacement anxiety, depression, trauma are just as real as the physical destruction left behind. Integrating mental health into evacuation planning is not only a best practice, it is an ethical imperative for modern emergency management. Thank you for your time. I look forward to your questions.